Welcome to my Lecto. Today we are going to discuss outflow of blood through the ventricle, specifically left ventricle, and the different terminologies related to the heart. So let's start. First of all, we will discuss the structures of the heart and the outflow of the heart. So here you see that as we know that the heart consists of four chambers, two atria and two ventricle. So here you can see that at the right side you will see the right atria and right ventricle. So in that situation, blood from the inferior vena cava and from the superior vena cava enters into the right atrium. So keep remember, deoxygenated blood enter into the right atrium. So from the right atrium, deoxygenated blood enter into the right ventricle through the valve which is called the tricuspid valve. So here is the valve. Keep remember that these valves are arranged in such a manner that the blood can enter into the right ventricle, but it cannot flow back into the right atrium. So they are especially arranged in such a manner. So same here, that when the blood enter into the right ventricle, then the blood enter into the pulmonary trunk. Here is the pulmonary trunk. And in that situation, you will see another valve which is called the semilunar valve, and in that situation same here, that the blood from the right ventricle can enter into the pulmonary trunk, but the reverse is not possible, but can be possible in some situation, but in normal situation the blood cannot flow back into the right ventricle. So from the pulmonary trunk, deoxygenated blood reach toward the lungs, and after oxygenation, blood again back towards the heart through the pulmonary vein. So this is the case, blood enter oxygenated blood from the pulmonary veins, four pulmonary vein enter into the left atrium. So in that situation, blood reach the left atrium. From the left atrium, blood move into the left ventricle through the valve, and this valve is called the bicuspid valve, or you can say mitral valve, another name for this valve. And after the left ventricle, this is actually the thickest one, membrane is thickest, and when it contracts, the contraction is very hard in the left ventricle. When it contracts, the blood through the aorta enter into the aorta, and before entering into the aorta, there is another valve which is also called the semilunar valve, and from the aorta you will see the arising of the different branches, and they supply blood to the upper extremities. And after that, there is a descending aorta. This branch, descending aorta, that it is actually the back side of the heart. And in that situation, descending aorta supply blood to the lower extremity. So this is the basically general overview. And in that situation, our main focus is on the left ventricle. Left ventricle is our main focus. And in that situation, you will see the two valve is actually attached to the left ventricle. Bicuspid valve and the semilunar valve is actually lie at the level of the left ventricle. So this is the case. Next, we will discuss the isovolumic contraction and isometric contraction. So you have to focus on the word. Iso mean same, volumic mean volume, same volume. Contraction, obviously, that's something compressing. So contraction of the heart when the volume remains constant. So this is the case. So before we discuss isovolumic contraction, you have to remember, or you have to know the difference between diastole, so diastole and systole. Systole. Diastole is the relaxation of the heart, and systole means the contraction of the heart. If I specifically says that when the left ventricle is relaxed, then I say that the ventricular diastole. When I say that the left ventricle is in contract state, then I say that the ventricular systole. So this is the case. And now move towards we will discuss specifically the left ventricle. And in that situation, you will see when the left ventricle is relaxed in diastole state, then what will happen? The blood through the bicuspid valve enter into the left ventricle and start filling the left ventricle. So this is the case. When the left ventricle in what state? Diastolic state. Diastolic state. Then blood enter and filling the left ventricle. Then it means after that the left ventricle contract and decreases volume and the blood exit through the semilunar valve. So it means after diastolic state you will see the systolic state. Systolic state in which you will see when the left ventricle contract and decreases volume, the blood compress and exit through the semilunar valve. Keep remember, as we have discussed, that bicuspid valve is arranged in such a manner that blood can enter and cannot reverse back. In the semilunar valve, blood can exit but cannot reverse back. This is the normal situation. And you see that from the diastolic state, when you see the systolic state, the blood exit. But between the diastolic state of the left ventricle and between the systolic state of the left ventricle, there is a state which is called isovolumic contraction. This state is actually between these two situations. This is the case. Let's say if I say that the left ventricle in diastolic is fully relaxed, blood enter, then what will happen? Then you will see the isovolumic contraction. It means in isovolumic contraction you will see the muscles, as we know that the cardiac muscle start contracting, but the volume of the left ventricle remains same, and you will never see the ejection of the blood from the semilunar valve. So in isovolumic contraction you will see the two important points. First one, in the isovolumic contraction you will see the contraction of the cardiac muscle. And second important point is that the volume remain same. Volume will be same. And third point, no emptying of the chamber or ventricle. So these 3 points is specifically important in the isovolumic contraction. And after the isovolumic contraction you will see the systole, which is the fully contraction, and after that when the systole happens, then the volume decrease and compress the blood, and blood in systole exit through the semilunar valve. So this is the case in which between the diastole systole you will see the isovolumic contraction. So next we will discuss the period of ejection. As we discuss here that blood, you will see that in the diastolic state blood entered through the bicuspid valve and filling the chamber, and after that you will face the isovolumic contraction, and in that situation ventricle start contracting but there is no ejection of the blood. So actually this is the left ventricle. And after the isovolumic contraction you will see the systolic state in which the blood exit through the semilunar valve. So this is the case. And if you see that, first of all, you see that the what percentage of the blood will eject from the semilunar valve. In normal situation, there is a range, but if I say that the 58% blood ejecting from the semilunar valve. So this is the case. Before we discuss properly the period of ejection, you should know the concept. So here is the case. Here are basically the two glass. Here is the two glass, and in that situation you will see this glass is full of water. This glass is full of water, and I say that this glass is 100% full. This is the case. And if I pour the water from this glass to another glass which is smaller in size, then after pouring water, then the other glass also become full. But in that situation, this glass is now become 50%. But now the water in this glass become 50% according to this glass. What will you say about the second glass? In that situation, I say that this glass is 100% full. This is the concept, that water present in both glasses is equal, but the water is 50% according to this glass and 100% according to the second glass. So this is the case. Here similarly happens in the left ventricle. When the blood eject, what percent? 58% blood has been ejected from the left ventricle. So in that situation, the blood level decrease in the left ventricle, and the remaining, I say that the 42% is actually present in that situation. So actually 58% blood ejected according to this chamber, and in this chamber you will see the 42% blood present in that. And I consider 58% which has been ejected as 100%, just like the water present in that situation. The water that pour into the other glass, I take it 100%. Just like I take the 58% of the blood that has been ejected from the left ventricle as 100%. So according to this concept, you can easily understand this one. So I consider 58% ejected blood as 100%. This is the case. Actually 58% is according to the left ventricle, but when it has been ejected, then I consider it 100%. So this is the case. Now we consider the period of ejection. Period, actually there is a time, and we divide the period of ejection into three parts. I divide the period of ejection into three parts. So here you see that first part is 1/3. One part out of three part. And you also see that this is the two parts out of three part. This is the case. This is the short time, this is the long time, because it carries the two parts of the time. And in that situation, in this part, in the 1/3 period, you will see the 70% blood will eject. And in the 2/3 period, in the long time, long duration, you will see the 30% blood will eject. So if you see in small time, large amount of blood is ejecting. So this is called period of rapid rapid ejection. Period of rapid ejection. See, this is the case. Small time, large volume ejecting. And this is called, in the large period, in the large time, small volume or small fraction is ejecting. Now this is called the period of slow ejection. Slow ejection. So these are basically the two situations. We divide the period of ejection into two: rapid ejection and slow ejection. In rapid ejection, in small time, large fraction will eject, and in slow ejection, you will see in long time, you will see the small fraction will eject through the left ventricle. So this is the actually the period of ejection. Next, we will discuss the isovolumic relaxation, or you can say isometric contraction. So if you see that now this left ventricle, here is the left ventricle, and this left ventricle is in, I say that the diastolic state and fully relaxed, and in that situation blood enters in the through the bicuspid valve and filling this chamber. And after the diastolic, you will see a state which is called the isovolumic contraction. Start contracting, but the volume remains same. And after the isovolumic contraction, you will see the systolic state, and in this systolic state, you will see the blood eject from the semilunar valve. So in this systolic state, volume decrease and compress the blood and blood eject. Now after that, after this systolic state, you will see again that the diastolic state. Now after the contraction or systolic state, now the left ventricle move toward the relaxation, which is the diastolic. But also keep remember, between the systolic and the diastolic state, you will see the isovolumic relaxation. This phase is actually present between the systolic and the diastolic state. And in that situation, you will see when they fully contract. Now, what will happen? In that situation, the ventricle cardiac muscles start relaxing, but the volume will remain the same. In the isovolumic relaxation. So this is the case. After isovolumic relaxation, the cardiac, or you can say left ventricle, move towards the complete relaxation, which is this diastolic state. So this is actually the whole process: diastolic isovolumic contraction, systolic isovolumic relaxation, and diastolic. So this is actually the whole process that happens in the cardiac muscles, or you can say specifically left ventricle. I'm talking about left ventricle, so you can easily understand what I'm trying to say. Next, move towards the different terminologies that are quite confusing, but hope so after watching this video, you will be able to differentiate these terminologies without any confusion. So, first of all, you have to know the full form of these terminologies. And diastolic volume, you have to just focus on the word and diastolic volume. The volume that is present at the end of the diastole is called and diastolic volume, which is the EDV. And systolic volume, the volume which is present at the end of the systole is called and systolic volume. Stroke volume, SV, cardiac output, CO, and ejection fraction, EF. So if I consider left ventricle, here is the left ventricle in that situation, and it is fully in diastolic state. So when the left ventricle is diastolic state, then the blood enter through the bicuspid, and in that situation you will see the filling of the left ventricle. And when the filling is at end, or you can say and diastolic is starting or moving towards the end, then you say that at the end diastolic volume, at the end of this diastole, you will see the volume, if I talking about normal, then 120 ml per beat. I say per beat, it means I'm talking about the one cycle in per beat. 120 ml present, the volume of the blood in the end of the diastole is 120 ml. Now, when you will see the isovolumic contraction and this systole. In this systole, you will see the blood will eject through the semilunar valve, and in that situation, you will see the volume of the blood in the left ventricle decrease. So, as I say, in this systolic state, so then it's mean at the end of this systole, what volume is present in the left ventricle? So it is called the end systolic volume, and it is actually the 50 ml per beat. I say per beat. Then what amount of volume will eject from the semilunar valve in one beat? And the volume ejecting from the semilunar valve in one beat is called actually stroke volume. So I say that the stroke volume, this is actually the volume that ejecting from the left ventricle in one beat. I can calculate stroke volume by these two, and EDV and ESV. So here is a formula, that end diastolic volume subtract the end systolic volume. So if you see that end diastolic volume is 120 ml per beat minus, you will see the end systolic volume is 50 ml per beat. So if I subtract 120 minus 50, you will see the 70 ml per beat. So you will see the 70 ml of blood will eject from the semilunar valve. So this is the case. Total amount of volume that is actually present at the end of the diastole is 120. After ejection, you will see the remaining volume in the left ventricle is 50 and 120 ml has been ejected. So the volume that ejected in one beat is the stroke volume. So this is the case. Next, we will discuss the cardiac output. So here is the term which is a cardiac output. They are actually quite similar, but there is a difference between them. It is actually the volume that is ejecting from the left ventricle in one beat. Cardiac output is actually the ejection of the blood in 1 minute. I am talking about 1 minute. So I can also calculate the cardiac output. Here you see that the stroke, if I multiply stroke volume by the heart rate, then if you see stroke volume is 70 ml per beat, and heart rate is normally, if I say that normal heart rate is 70 beats per minute. Heart rate, it means in normal situation in 1 minute heart beat approximately 70 times. So this is the actually called the heart rate. And if you see that they cancel, beat cancel up and down, and in that situation if I multiply 70 with the 70, you will see 49,000 ml per minute. So if I say cardiac output, then 4900 ml will eject from the left ventricle in 1 minute. This is the cardiac output. Stroke volume 70 ml. This is small volume, and 70 ml blood ejecting from the left ventricle in one beat. So this is the case. This is the one beat, this situation, and in that situation you will see that the in 1 minute. So these are basically the stroke and the cardiac output. Next, if I say ejection fraction is the how much percentage of the blood is ejecting through the semilunar valve. That is called the ejection fraction. So I can also calculate the ejection fraction. If you see here that ejection fraction, I can calculate ejection fraction by dividing the stroke volume by the end diastolic volume and multiply by the 100 if I want to calculate the percentage of the blood that is ejecting. It is actually the percentage that is ejecting from the left ventricle, and it is called the ejection fraction. As the name indicate, there is a fraction. So you can say fraction is means that something that is present in our form. So systolic volume, or you can say stroke volume, and the end diastolic volume divided and multiply by 100. So if you see that the stroke volume I have calculated, so here is the 70 ml per beat, 70 ml per beat, and if you see the and EDV is the 120 ml per beat and multiply by 100. So you see ml per beat, up and down, ml per beat cancel, and if I divide 70 120 and multiply by 100, then the answer will be approximately 58%, and that is called the ejection fraction. As we discuss here, 58%. The percentage of the blood that is ejecting from the left ventricle is actually called the ejection fraction. So this is the whole terminologies, and hope so you got the difference between the stroke volume, cardiac output, ejection fraction, EDV and ESV. So this is all about the outflow of blood through the ventricle and the different terminologies that is related to the heart. So if you have any question, then you may ask in the comment section. Thank you so much.